I'm Heather Stockwell. I've been in New Hampshire now for over 50 years, and grew up here. And 5 years ago, really got more into politics than ever before. My father, in full disclosure, my father was a state rep, and for like 15, 16 years or something. And I didn't really get into politics until later in my life when I finally started to have my own opinions and understanding things better and not so afraid to kind of talk about it more, right? And one of the things that I organize around healthcare, and it's just one of the issues that I've struggled with most of my life, and I am realizing the more I talk to people, I'm realizing how many issues people are having with actually accessing the care they need. Pause, big sigh, right?
Yeah.
It's kind of a problem, when people have to start a GoFundMe just to afford to be able to get a treatment or even medications sometimes that are really super expensive. So what's happening down at the Hopknot is we're having this healthcare town hall. People are welcome to come, share stories, like talk about what's going wrong with getting the health care that they need. Like we are really trying to build this supportive community. This is kind of a different campaign that I've worked on, at least because it's really it's like a narrative campaign as opposed to like we're going to change things with legislation, right?
Yeah.
And changing the narrative, sounds maybe easy, but not always. It takes coming on shows like this, getting the word out there, talking to people, because 9 times out of 10, I find people actually, no matter what side of the aisle they're on, if they've struggled with healthcare, they agree that we all need some kind of national health program plan. And so in order to do that, we are really kind of attacking or trying to, it's an anti-corporate campaign, right? We want to change the narrative that corporations really have any public good in the system at all. Because as far as I can tell, and I think a lot of people would agree, that they don't, that they actually report, billions of dollars in profits while everyday people that need care are starting GoFundMes or just not getting the care that they need, or they're rationing medication. I mean, this has become so common with people. It's really frightening that people are literally dying. So, yeah, I mean, that's sort of it in a nutshell. We eventually might get, in another House session, we might get to a place where we're like, okay, we need to change this regulatory thing to help hold those insurance corporations accountable. Because right now, they kind of have free reign. They get away with stuff. They make so much money, they can pay, they can totally afford to pay any fines, and they just keep going or find a new loophole. So we're sort of watching for those kind of things, like what might happen. In New Hampshire, we pretty much have almost everything is privatized at this point. All of the Medicaid plans are, managed care, privatized, plans sold through insurance companies. And Medicare is doing the same thing with Medicare Advantage. Those are all private plans, and now some of those plans, the Medicare Advantage plans, are open to private equity to get involved in making more money off of our care that we're not getting. So when I say we're building a community of folks, we're building a community of folks that have been harmed by the insurance system, right, that we have, our private insurance system. And we're helping folks, just to know their rights and to know that there is an appeals process. It's quite arduous, but it is the avenue that we have to make our complaints, right? Every plan has a little bit different policy. Like some you have to get it in within 30 days or 90 days or 120 days. They don't make the process very easy, but that's part of what we're trying to do is like help people out with that process, and even being with them on phone calls if they need that kind of backup. In some cases, we might refer people to this. We have a team of national lawyers that are working with us. They can help advise. They won't represent you because they're working on this campaign. But they can help advise you on what to do next. And in many of those cases, we take like a collective direct action together to help overturn those denials. And we've actually been successful in a couple of cases, like one in Chicago where a woman went for just simple blood test and it's supposed to be covered according to her plan, but then she gets stuck with $1,000 bill.
Yeah. It's
it's that kind of thing that's ongoing. And $1,000, maybe doesn't sound like much, but I had one for $6,000, and somebody else. We all wrote letters to the CEO of Blue Cross Blue Shield of New Mexico for a woman named Brittany who has several rare diseases. Could only have the surgery in California because there's like only 6 doctors in the country that do this or specialize in this.
Yeah.
And it was then they had everything approved, and then they backed out somehow. They found some loophole, backed out, and she was stuck with a $400,000 bill.
No, it's maddening.
All the phone calls actually got it overturned.
Oh,
not
really?
by the insurance company, but by the hospital.
Oh, wow. No kid. Okay. Well, that's positive then. Yeah. Just a couple thoughts on what you were saying, Heather, with, you mentioned people starting GoFundMe campaigns, and I remember a few years ago when I, just in doing some reading, because I'd been a little bit naive to this. I just assumed that when people started GoFundMe campaigns, it was because maybe they just didn't have any health insurance and something catastrophic had happened or something like that. What I did not know, and I don't remember the numbers, maybe but I was shocked to learn the percentage of people who start medical GoFundMe campaigns who actually do have insurance and have full coverage, but quote unquote full coverage, because what ends up happening is even with full coverage, the insurance company, if they can find a good reason, or not a good reason necessarily, but what they can justify, they'll find a way to deny you, because so even so you can have insurance and still get denied for the coverage that you need, and I mean, let's be blunt. Let's look at it. The reality of it is this. It is and look, this is coming from a free market capitalist saying this, but let's address it honestly. When it comes to the insurance companies, they make their money from the premiums that are paid to them, and at whatever point it is that you're an asset as long as those premiums are being paid. At whatever point it is that your premiums no longer justify financially the amount of money that they're having to pay out for your care, at that point, you go from being an asset to a liability. So if we're really being blunt and honest about it, at that point, what they would prefer from a business standpoint is that you die, because they don't want to have to keep paying for you. You were making them money with your premiums. Now you're costing them money. They would rather you die. And that's the blunt reality of it. And realizing that and really fully understanding that was part of what brought me over to the side of, I think we should follow Canada's model. I think we should have single payer socialized medicine. I really do. It took me a while to get there, but I'm all the way there at this point. Wow. And the other thing I would add to that, and again, that's coming from a free market capitalist, but the other thing, and this is a principle that I've always held, is that we live in the most prosperous, most innovative, most successful country in the history of the world. And yet we somehow, taking all that into account, we somehow can't figure out a way to make sure that every single American has access to adequate or better than adequate health care. I don't buy it. I've never accepted that, because there's always people who will say, well, Matt, you just can't do it. It'd be nice if everyone could have the health care that they need, but there's just no way to do it, Matt. Sorry. It's like, no, BS. Of course there's a way to do it.
I call BS on that too. I mean,
yeah.
We're obviously smart enough, I think.
Yeah.
People have come up with some plans. It's a matter of really sitting down and hashing it out. I mean, I've even talked to people that, work for or own insurance companies, and they'll outright say, you're talking about something that is different from insurance. You want something that you can use every day. It doesn't fit the model for insurance.
Right.
Insurance is something you don't want to use, that you only use in an emergency, right? Like, they're two different things, and we're expecting the insurance industry to do it for us, and it's not the right fit, right? Because they have a for-profit model, and
Right.
granted, everybody needs to get paid. But I agree. Like, I come from a conservative family. I've had two businesses, and I have found loopholes to get out of paying, don't hire people full time or things like that. That was sort of the ticket, not to have to pay employees for employees' health care programs.
Right.
And now you talk to business owners, and they will tell you over and over again, if they supply any kind of health insurance to their staff, that it's their number one increase of cost.
Oh, yeah.
Every year. And what ends up happening is, if somebody has a big enough business, those insurance companies will actually negotiate with them to bring that cost down, but they negotiate some of your care out of it.
Yes.
And good luck if you need that care, because it's no longer available to you.
Yeah, exactly. It's no, it's a terrible system when you really get down to it. And it's like, and I'm no great fan of Elizabeth Warren, but during the 2020 primaries, she was talking about, she supports I think she supports socialized medicine, and she was saying, because you always hear people say, well, I like my health insurance, I don't want the government messing with it. And she said, well, everyone likes their health insurance until they actually need to use it.
I've said that.
Yeah. Because, like before I was, I'm an entrepreneur and I'm self-employed, but when I used to work for, I used to manage, I was a store manager for a national retail chain. And we had really good health insurance, but I never thought about it either. Like, if I had to go to the doctor, which, knock on wood, I've always been pretty healthy overall. But if I had to go to the doctor, it's like, okay, I pay the $10 or the $20 copay, whatever it is. And then, that's it, and forget about it. Never even see a bill, whatever. But if, God forbid, something catastrophic had happened to me, who knows what I would have been facing. It's easy to say, oh, I like my health insurance. I really liked my health insurance when I worked for that company, but I never really had to use it either, aside from, if I had to go, or, if I went to the eye doctor, like when I had LASIK done or something. Although actually LASIK wasn't covered, so that's a bad example. Although it's still worth doing, but not that expensive either. But anyway,
especially not in Canada.
Right, that's true. Yeah. But
I actually went with a family member for some LASIK surgery in Canada more than a decade ago now.
Yeah.
Yeah, I mean, that's pretty common. I mean, we're also seeing, what I think people are referring to as, healthcare, not vacations, but it's like healthcare travel. People go to other countries. People go to Mexico and have their teeth done in Molar City. They literally have called it Molar City.
Oh, no kidding. I didn't know that. Wow.
I mean, and then, for other things that other countries might specialize in, that's kind of crazy. I mean, there was also a report out, I think it was just in the last year or two, that the age that more cancer diagnoses were happening at age 65. And they figured out, or they surmised, that was because that was when people got on Medicare. And could supposedly afford it. Although I will just say right now, my husband just got on Medicare, and it's not really looking like they're going to pay for much. And there's a lot of confusion on a lot of things between the provider and the insurance carriers.
Right.
So, I feel like if a pandemic hasn't forced us to, kind of reckon with what we have going for our healthcare system, I'm not quite sure, what needs to happen here, honestly. And one of the things that I'll just say, like during the time that my husband and I faced this $6,000 bill or denial, we felt really alone. We didn't know who to talk to.
Yeah.
We struggled for like a full year. We made phone calls. We spent 40 to 80 hours just on phone calls back and forth, not even necessarily including all the time on hold.
Oh, yeah.
Just trying to work it out. And, eventually they sent it to collections, and we were like, hey, we're appealing. We're appealing again.
Yeah.
We're not taking no for an answer here. We don't have $6,000. And, frankly, their reasoning was about a code. And my response was like, they said, oh, it's patient responsibility. And I was like, but it wasn't wasn't the patient's responsibility in the first place to have the code for the pre-authorization.
Right,
That's
right.
Not our jobs. So a lot of the labor is getting put on the patient also, that from my own personal experience, but hearing from others, I'm like, man, I have to do it all. Like, if I want a new doctor, I have to go do the research.
Mm-hmm.
I want to get a referral to a specialist, I have to do the research or just take what they give me.
Yeah, isn't that nice when you're already dealing with an illness and now on top of it, you have all this other nonsense that you have to deal with just to get your illness treated? It's
right.
It's
right. And if you have some kind of something weird or not too common, that just makes it all the more difficult to get your care.
Yeah.
Because they really want you to just have something that everybody else has. They already have the paper. They have the prescriptions ready to give you the paper and the prescription and go out the door and buy.
Yeah.
They're just not used to dealing with complex patients, or the system isn't set up for complex patients, partly because it's all run by algorithms at this point, right?
Yeah, I suppose if it's if you're talking about illnesses that are rare, there's probably not much money in researching those or figuring out how to treat them. So it just doesn't end up happening.
Right.
Yeah,
for sure. And if you're part of any minority group, whether you're BIPOC or female, you might be. A lot of assumptions get made.
Mm-hmm.
I'll just say that. Or if you have some kind of disability, a lot of or you're fat. I mean, God, I have been as a fat person. I mean, I can count at least 4 times that a healthcare professional has assumed that I must have diabetes.
They just assume,
and I don't.
Oh, really?
I don't.
They just
clear. I could show you the blood work to prove it, and I often now joke with my doctors sometimes about it. Even the ones that assumed that in the first place.
Yeah, they just assume it. That's bizarre. Huh.
It's and I recently found out, or last year sometime, was on some national call, and I was in people were talking about their healthcare stories in this breakout, and I mentioned it. 4 other people on that call said same thing happened to me.
Yeah. Wow.
I was like, I felt a little bit better that oh, this isn't just me. Oh, cool.
Yeah.
But it's also like, wow, this is happening over and over again. And, I don't eat a lot of junk food. I eat a really good diet. I do eat some junk food like most people, but,
sure.
I eat my veggies and, eat a really balanced diet. So being scolded by the medical community that I'm not taking care of myself is kind of,
Yeah, I can see.
Wrong.
I can see how that would be frustrating. Hey, by the way, so this event, it's happening at the Hop Knot, of course, which also happens to be our amazing sponsor here on the program and one of our sponsors here at WMNH. How did you get connected with the Hop Knot?
Just, I guess, through some friends and stuff that said, hey, this is a great new business. We should go and support it. BIPOC owned. Yes, let's. They also had a great Juneteenth celebration this summer, which I really liked, because what I found with when we as a country now recognize Juneteenth this year, I felt like a lot of the Juneteenth celebrations got very sort of corporatized.
Sure. Yeah.
Quite frankly, it was like the town and, the YMCA or the, this business or that business took over the thing, and it kind of ruined it for me because I was like, yeah, but this isn't supposed to be about making money here right now. Like, unless maybe you're a BIPOC-owned business, so let's support that, right? Like, let's do it.
Right.
So anyway, that was part of it. I wanted to find something downtown. I wanted something like close to like people because we're going to have this town hall. We're going to have, we'll have some coffee and nosh, whatever, something to nosh on in the morning. And that'll start at 10:30. We're going to start the town hall, and then at noon we're going to end the town hall. It's a hybrid event. You won't get the coffee and the food stuff, obviously, if you're going to join virtually. But if you register for the event and say you want to attend virtually, you'll get a Zoom link.
Oh, cool.
So we'll have a camera and microphones and stuff set up there so that people can really be engaged and immersed in a live event in maybe in a different way that they're used to. They're really trying hard to make it accessible for anyone, because obviously it's I thought Manchester is kind of middle of the state. Mm-hmm. I'm a statewide organizer, so strategically I feel like it was a good place to be. So afterwards we're going to have lunch, and then for those who want to stick around and help out and get more involved, we'll have a brief training, like sort of over lunch, with our field manager, and actually she's from Iceland, so knows all about what their healthcare system is like.
Yeah.
And then we'll go out street canvassing, talking to people on the street and giving them some information, trying to get them to maybe sign our petition. Mm-hmm. If they have a denial, we definitely want to talk with them about it and see if we can help.
Yeah. Yeah. No, that's excellent. That's great work that you're doing. So it starts at 10 a.m. I just want to make sure we have the times right. So it basically starts at 10. Okay, gotcha.
Yep, starts at 10. We'll have lunch around noon. They're going to have a bunch of sandwiches ready for us right at noon, so that we can just kind of keep our schedule going, get people, fed and out on the street, really ready to talk to people. We have like a little. Well, I would say it's not like a strict script. It's sort of like, here are some opening questions you can ask people. Here's some of the facts. Here's what we can do, for you, with you, things like that. So people feel hopefully really comfortable getting on the street and talking to people.
Right.
Oh, yeah, and some facts. Honestly, in 2019, New Hampshire was number one, or not number one. We were, we're number one in premium rates. That's our claim to fame.
Oh, I didn't know that.
We also have double the national average of denials. Kaiser Family Foundation, that does a lot of healthcare, surveys and reports, briefings and stuff. They put out this thing this report saying 17% across the country. New Hampshire came in at 31.9% in 2019.
Oh my God!
And I thought, wow, what is happening in New Hampshire? It's come down a little bit since the pandemic, but I feel like now that we're sort of out of that era, we're going to start seeing an increase again.
Yeah,
seems likely.
Yeah, well, that's frustrating. And Heather, too. Before we let you go, you've been very generous with your time today, and we appreciate it.
Thanks for having me.
Absolutely. And we should make this a semi-regular thing too, because the work that you're doing is very important. And I'll let you and Jenny figure that out. Of course, she does the scheduling. But
cool.
But anything you want us to know about websites or resources that people should know about?
For sure.
Yeah.
For sure. I'll give you a couple of things. careovercost.org is the national website for the campaign.
Okay.
So especially if you have listeners that are out of state, that's going to be the place for you to go and get engaged in this campaign. If you're in state, I'm the local organizer in New Hampshire, and on our website, which is radmovement.org, And that's like a couple of clicks in. You'd have to go to campaigns, and then
Sure.
you'd see healthcare or healthcare justice or something. And then when you click that, you'll end up on the healthcare page, and you'll see, I think, the first thing you come is a thing to click on for the Care Over Cost campaign. So you can sign that petition right online on our website, and not have to, sign it on a piece of paper.
Yeah.
So that's pretty easy. And, people are also welcome to reach out to me at heather@radnh.org. That's my email address.
Okay.
I'm pretty good about getting back to people pretty quickly, especially when it's pertaining to this, because we know that our healthcare is, deeply important.
Yes. Absolutely. All right, Heather. Well, thank you so much for your time today. It's been a wonderful discussion about a very challenging topic, but again, I'm glad that you're doing the work that you're doing, and I'm sure it'll be a very successful event Saturday morning, starting at 10 a.m. at our amazing sponsor, the Hop Knot at 1000 Elm Street. We love the Hop Knot. So
we do too. We
do
too. So I'm really looking forward to it. I hope folks will come on out, regardless of whether you RSVP or not. Come on down, and chat with some folks that really want to be there and support each other through our struggles with our healthcare system.
Outstanding. All right, Heather Stockwell, thank you so much. We appreciate the time.
All right. Have a great day.
Thank you. You too. Bye-bye.
All right. Bye now.